Thank you. So anyone want to hear a fun fact? My 13-year-old a few months ago asked me that question, and I said yes. And he said, fun fact, 100% of the time I ask that question, the answer is yes. So that's not the fun fact for today. The fun fact is that in the past 150 years, there have been twice as many US presidents as there have been confirmed surgeons general. It's kind of fun, I didn't know that.
That's interesting.
Our next guest, Dr. Jerome Adams, served as just the 20th US Surgeon General and only the second ever African-American male in that role. His commitment to public health and health equity began long before his tenure as the nation's doctor. Over the years, he's worked in both local and state public health, first at the city of Berkeley's health department, and later as the commissioner of the Indiana State Department of Health, where he navigated the Ebola, Zika, and HIV crises. Long a fixture within the organized medicine community, Dr. Adams has been a leader in numerous professional societies and has practiced as an academic anesthesiologist over the past 20 years, even while serving as Surgeon General. Most recently, he was named a distinguished professor and executive director of health equity initiatives at Purdue University. And last but not least, Dr. Adams recently authored Crisis and Chaos, a book about the COVID-19 pandemic that is part memoir and part lessons learned. But the accolade Dr. Adams is most proud of is the acronym DAD, being the first Surgeon General in recent times to serve as the nation's doctor while helping to raise 3 teenagers. Please join me in welcoming the 20th Surgeon General of the United States of America, Dr. Jerome Adams.
That was fantastic.
Welcome.
Well, good afternoon, everyone. Really looking forward to the conversation here. First of all, I've just got to say, I am pumped after Sister Mary's talk. I just really am. It was truly, I go to church and sometimes the sermon hits and sometimes it doesn't. We all know that, right? Well, that sermon hit. It was exactly what I needed to hear because it really channeled a lot of the concerns I have in our community, in our world, in our country right now around whether or not we're living up to the Christian ideal of walking in Jesus's path and truly loving our neighbor. I mean, I say this at least once a week to somebody because people love to quote the Bible, and I am not a theologist. I'm not an expert, but I do remember that the 2 most important commandments per Jesus were love God and love your neighbor. And I don't think we're doing enough to love our neighbors right now. So I really needed that, and thank you, Sister Mary, for helping me feel like there are other people out there who agree with a lot of the concerns I have about where we are.
You're not alone, especially in this room. Dr. Adams, Sister Mary talked about our calling in Catholic healthcare. Can you talk about your personal journey and calling to be a physician?
Well, what's interesting about that is I don't know that I was so much called to be a physician. And I talk to residents and medical students all the time. I'll be in the OR tomorrow working with residents. And what's hard for them is a lot of them feel like they're supposed to have this epiphany moment, this the burning bush moment, when someone comes down and says, you shall be an OBGYN, or you shall be a family practice doctor. And that's not the way it was for me at all. For me, both my parents were school teachers. So I grew up watching them take care of other people's kids, really be servants themselves. It instilled in me a desire to stand up and fight for other people, which we know Jesus did throughout the Bible. And I frequently would clash with my teachers. I probably shouldn't say that. But it was oftentimes related to standing up for someone else who I felt was being wronged or wasn't getting what they needed. But Jesus also has a way, God has a way of planting seeds in your life. And so that's me, honestly, a few weeks after my first communion, but a few weeks before, I almost died for the first time in my life. Grew up in a small rural community, and I have asthma, and I had an asthma attack so severe I had to be medevaced to Children's Hospital in Washington, D.C. To save my life. And so that didn't make me want to be a doctor, but it helped me understand that certain people were born with different burdens. And you heard Sister Mary talk about this. There is a burden that many people in this country face simply by nature of growing up in a rural community, or simply by nature of the color of their skin, or simply by nature of being someone who served in the military. And so for me, I intuitively, I didn't know these stats, but I intuitively knew that I was in the hospital 5 times as often as other people. I was in the hospital 17 times in 1 year. And so that was just embedded in me throughout my history of growing up, that idea that there were inequities, and I always wanted to address those inequities. God gives everyone different gifts, gave me the gift to be good in STEM. And so I actually went to school to be an engineer. I never dreamed I could be a doctor. And it wasn't because I didn't have the aptitude. I had straight A's in high school and in college. It was because even though I was in the hospital 17 times in 1 year, I'd never met a black doctor until I went to college. I went to college in Baltimore, Maryland, went to a talk, and at that talk was Dr. Ben Carson. And I said, I guess there are black doctors. And it really opened my eyes and showed me that, hey, you can use your skills to heal. Again, going back to the Bible, Jesus was a teacher, Jesus was a healer, Jesus was an advocate. And so I leaned into medicine and really enjoyed that, but I found that I also had the opportunity through my role as a doctor to be an advocate for change for people, and that got me involved in public health and in my political roles. And so that's a little bit of my journey to really trying to follow the path that I did, and to understand what God was calling me to do at different points in my life. And I think the lesson for all of us is that we don't have to be stuck doing one thing. I'm glad there are cardiovascular surgeons who that is their gift, that is their talent, and that is the one thing that they want to focus on, because I'm probably going to need them one day. But for most of us out there, we're going to have different seasons in our life, and I think the quest is always trying to figure out how do the gifts in the environment that I'm in at this point in time match up with my mission to actually trying to help and serve others.
Thank you. And you practiced at Ascension St. Vincent?
I did. Yep, I did my internship at Ascension St. Vincent's in Indianapolis, and actually that is where I was encouraged to get my master's in public health and pursue that pathway, because it's not something that many people in medicine are exposed to. We often separate public health from healthcare.
Can you talk about how faith has shaped your personal and professional life?
Certainly shaped my my personal life in many ways, but professionally, in the operating room, and I'm going to be at our Level 1 Trauma Center, urban hospital in Indianapolis tomorrow. Frequently, the patients who come in there, they're not the easiest to work with. They have mental health issues. They're often belligerent. There's a lot of folks who come in and they're there because they've committed crimes and gotten hurt. And when I'm in those situations, I think back to, again, a lot of how I grew up. I told you I grew up in a rural community. We also grew up really, really poor. And I think back to the Bible of love your neighbor. And so it's easy to get frustrated when you see the same people over and over and over again. It's easy to feel like, okay, well, what are they doing wrong? And that's when I think leaning on the teachings that I was given helped me realize what I'm there for. I also have been through some really, really tough times. And make no mistake about it, serving in any administration, but particularly the administration I was in, and particularly during the time that I served in that administration, during the opioid epidemic, but of course during COVID, was very tough. And I will tell you, I frequently remembered and was counseled by my friends that no one in the Bible thought they were the right person for the job. Everyone was a reluctant servant. Everyone in the Bible said, "Are you sure you want me? Are you sure I'm the right person? Because I don't feel like the right person." You know, from Moses to Noah to essentially every single one of the disciples. And so remembering that really helped me in my toughest times. Remember that if you're uncomfortable, you're probably right where you're supposed to be. And you should be asking yourself, okay, why am I here? And how can I make the most of this current situation? So those are just some of the ways that my faith has guided me. But I tell you, I really leaned on my faith during 2020 because I was out there in the public spotlight, on TV, trying to do the best I could. And in many cases, the people who I was fighting for were the ones who were out there just attacking me viciously. Attacking me viciously. My own mother, she loves me to death, but I talk about this in my book. I have this picture of my house right now. It's a picture of my mother. She came by the White House, and they were honoring me. And she's standing next to the President of the United States. And my mother has a scowl on her face because my mother does not like the President of the United States. And you think about this. You think about the fact that, that for most people, the proudest moment in their life would be seeing their child honored at the White House. And I do believe it was one of the prouder moments of her life. But she couldn't get over that disdain that she had. And that's my own mother. So think about everyone else out there. And so I really did. I frequently leaned on my biblical teachings and remembered that there's someone who came before us who went through a whole lot worse than anything I would ever have to go through.
Thank you. This is great grounding for the rest of our conversation and the rest of our time here together over the next couple of days. We're going to be exploring how Catholic healthcare can work together to reimagine health in a way that elevates human flourishing. What does those words, what do the words human flourishing mean to you?
Well, if you're interested, I wrote an article in Stat News entitled, "We Need a Better Discourse on DEI." And I say that because ordinarily I'd say human flourishing is health equity, but we're not allowed to say equity anymore. We're not allowed to talk about diversity or inclusion. In many cases, it's actually been, it's illegal. They've fired people who had those titles in their roles. But my definition for human flourishing is the same as my definition for health equity. It is when everyone has the opportunity to make healthy choices and can be their healthiest and happiest version of themselves. That's my simple definition. But I think it's important to understand you're at a health care event, and we've already used the word health care frequently, but health care is not health. So you can't get to flourishing simply by thinking through the lens of health care. It is important, it is an ingredient to health, but we have to get out of this medical model. And I love that Sister Mary talked about the community impact report. We spend about 90 cents of every health dollar in the United States on 20% of the problem, downstream clinical care, what happens in hospitals and what happens in clinics. And that's a lot of what you all in this room control and think about on a day-to-day basis. The problem is 80% of what makes you healthy happens outside those hospitals and clinics. It happens in the community. It's things like health behaviors. It's things like social and economic factors. It's things like the physical environment. And it's about changing the system. You heard Sister Mary talk about this also. W. Edwards Deming said every system is perfectly designed to get the results that it gets. People are not flourishing in our country right now because our system is designed to get the results that it gets. The other thing you have to remember is what W. Edwards Deming said, a bad system will beat a good person every time. So I believe that everyone in this room is a good person and is here for the right reasons. But if you put your head down and just focus on what's in front of you and don't look at the broader system, a bad system is going to beat a good person every time. So what's the human flourishing, the health equity approach? It's making sure we're focusing on those other factors even as we're focusing on downstream clinical care. This is from my report, Community Health and Economic Prosperity. I was actually at the St. Louis Federal Reserve this morning. I went for a quick walk. If any of you have time, they have a free museum there called the Economy Museum. And it's an amazing museum, but they actually talk about this in the museum down the street a few blocks away. The fact that we need to build high opportunity communities. This is literally what the Federal Reserve, part of their charge is. It's not just about interest rates. It's about building high opportunity neighborhoods with quality schools, access to early child care and education, quality housing and public transportation, availability of jobs, and healthy living conditions. That is what human flourishing to me is about. And that is my challenge to you all here this week, but also in your day-to-day jobs, is to think about what we can do to build healthy, high opportunity communities where everyone can flourish.
Thank you. So January 2020, caregivers at Providence.
Ooh, I'm having PTSD.
Providence Regional Medical Center, you're not alone again in that, admitted and diagnosed the first confirmed case of COVID-19 in the US. You were our nation's doctor at that time. There's a lot about that time that I can only speak for myself that I don't care to remember, but it's also very important to learn from experiences like that. What are the big takeaways and key learnings that you had from your purview?
Well, I'm going to start someplace that I wasn't planning on, but one of my big takeaways and learnings is that we've not learned anything. I mean, I hate to say that. I hate to be cynical, especially in front of this crowd and at this event. But when you look at Hanta, when you look at Ebola, we are making the same mistakes all over again that we made before. And that is very specifically the reason why I wrote the book that you mentioned, Crisis and Chaos, was to help us understand, again, to think back to faith and religion, the obstacles that come to us in our life, they're sent to us on purpose. They're sent to be trials, challenges. We're supposed to learn from them so that we can do better in the future. And I don't feel like we're doing better right now in the future for any number of reasons. But a couple of high points. I do think that one of the lessons learned, and this is an important one for all of you all because you're all leaders, is you can't make good decisions with bad data or with no data. So you talk about early January. We did not have visibility. We didn't have testing. So we didn't know who was positive or not, or where it was occurring. And it actually led to bad policy. We put out nationwide policies shutting the whole country down because we didn't know where the virus was. And I think one of the things that was positive that came out of it was many hospital systems came together locally, regionally, and shared data. And we went from me literally not being able to tell the president how many COVID cases we had in the country or how many hospital beds we had, to having real-time dashboards that gave us all that information. And so that, I was optimistic actually when we came out of COVID, but we've gone backwards yet again. I also would say that one of the lessons that I think we need to take, and we haven't taken from it, is that we need to understand our own biases that we bring to the table. Speaking of my mother, again, speaking of the Fox News versus the CNN and MSNBC crowd out here, because bias deeply impacted a lot of the way we viewed health decisions. I'm convinced that that the pandemic would have played out completely differently had it not occurred in an election year. Obama got Ebola in a non-election year. We got COVID in an election year. And so January, we were figuring things out. February, we raised the alarm. March, April, we actually were together. Remember, we were making masks and like converting factories into building PPE and hand sanitizer. Well, then what happened in April? The primaries started. And all of a sudden, we weren't having scientific and health discussions, we were having political discussions. And if you supported COVID precautions, you were voting for Biden. And if you didn't, you were voting for Trump. we're going into 4th of July. I remember June of 2020, I went on CNN. They asked me, Dr. Adams, can you come on and tell people how to stay safe over the 4th of July? And I said, sure, that's my job. I'm the Surgeon General. I'll come on and tell people how to stay safe. And so I'm there waiting in the green room. And this is the lead-in. Donald Trump wants to hold a maskless rally at Mount Rushmore this 4th of July. Remember that? Our experts say thousands could be infected, hundreds could die. Coming up next, Donald Trump, Surgeon General, to explain. That is literally how they introduced me. And so I go on the air, and they say, Dr. Adams, won't you condemn this rally that Donald Trump wants to hold? This is not at all a medical conversation. It is a politically framed conversation, and many of you all probably saw that interview and didn't even realize you were being led by the nose to have an opinion about what I was going to say before I even opened my mouth. And I said, look, I want people to understand their personal risk. Are you obese? Are you older? Do you live with someone who is at risk? I want them to understand the circumstances they're going to. Are you inside? Are you outside? Are people going to be masked? Are they not? And I want them to make a decision that is right for them. That is what I said. I stand by that to this day. And I got ripped to shreds by the public health community, by the medical community, by Democrats for my advice for not condemning Donald Trump as CNN told you all I was supposed to do. Now, here's specifically why I answered that question that way. Number one, because it's my job as a doctor not to judge you whether you have substance use disorder or anything else out there. People make bad choices every day. It's not our job to judge them. It's our job to give them the best medical advice we can and hope that they make a good decision. But at the same time, there were people contemplating whether or not to go to a Mount Rushmore rally to see the President of the United States. There were Black Lives Matter rallies going on right outside here, literally right outside here. And if I went on CNN and said, I'm condemning people gathering to see Donald Trump at Mount Rushmore, I was going to have to go on Fox News the next day and explain to Sean Hannity why it was perfectly fine for the Black Lives Matter rallies to continue going on. And again, it wasn't my job to place a value on what you were doing. It was my job to help you understand the risk and how to mitigate your risk. But so many people, including many of you all in this room, were led into thinking about things through a political lens while believing you were thinking about it through a scientific and medical lens. And I think that's one of the most important lessons for us.
Yeah, thank you. Thank you for that. Yeah, I still remember clearly the 7 p.m. Banging of the pots and cheering for healthcare workers, and it happened all over Seattle and all over the country and world. And at that point, it felt like we were heroes and we were treated as such. And then shortly thereafter, it feels like we're taken for granted again. And I don't know if you agree with that sentiment, but what do you think about that? And what, if you do agree, what do you think we can do about it as a society?
Well, I think there's a lot of reasons that happened, and let me see. So here we go. I think that we have to understand this is the environment that we're in. We're in an environment where people feel like they cannot access the healthcare system. Drug costs are through the roof, and it's destroying budgets for patients and employers. GLPs are revolutionizing health, but they're also breaking banks. I'm at Purdue University. Our increase in drug spend last year at Purdue University was $1 million just for GLPs. Just for GLPs. It's leading to all sorts of interesting things. Compounding. I mean, who would have thought 5 years ago that it would be perfectly normal for someone to go online and get a vial delivered to their front doorstep and then pull up something from the vial in a syringe and inject it in their butt? But that's literally normal right now, and it's happening because of the price of drugs out there. Affordability. Medical debt is the cause of 2/3 of bankruptcies. And you asked, about how we were cheering for people versus not. Someone was literally assassinated in broad daylight in New York City, a healthcare executive, and the person who did the assassination is now a folk hero in the United States. This is the world we're living in, and you have to ask yourself, why is that happening? It's happening because people are angry. People are frustrated. They've shifted, and a lot of that has to do, and we have to acknowledge that hurt, that frustration that people are going through. And none of us are immune. Some of you have heard my story. Anyone hiked up Camelback Mountain in Arizona? I was at the Society of Critical Care Medicine meeting in Arizona, and I went for a hike up Camelback Mountain, came back down, give you the quick version of this story. Went out to dinner that night with some nurses and doctors, felt a little lightheaded, knew it was probably dehydration, but they said, you're 50, you need to go to the hospital and get checked out. So call an ambulance, go to the hospital, get a couple of bags of IV fluid, a Chem 7, a chest x-ray and an EKG, and 3 weeks later, or 6 weeks later, I got a bill for $10,000. $10,000. That's me. And I'm still fighting with the hospital over that bill for services that I can go out right now and get for about $500. That is the frustration people have. We're 4% of the world's population, yet we consume 50% of the world's medical resources, yet rank 67th in global life expectancy. And I don't want to get too political here, but a lot of the wind in the sails of the MAHA movement comes from this frustration. The eye test, a lot of what MAHA is pushing isn't necessarily scientific or evidence-based, but we can't ignore the fact that what we are doing isn't working for most of America. Definition of insanity is doing the same thing and expecting a different result. And so people are saying, we can't keep doing the same thing where we're spending all this money and ranking 67th in global life expectancy. Not a problem just for minorities and marginalized populations. A college-educated US white male is going to have a life expectancy that's less than a college-educated European white male right now because of the fact that we have such a poor system here in our country. And why is it happening? Well, a number of healthcare reasons that I mentioned, but again, that's only 20% of the problem. We're #1 in wealth, but we're also #1 in concentrated poverty. We are the richest country on the planet, and we're also the poorest country on the planet. But those two things both exist in the United States when you look at concentrated poverty. No access to universal health care, as Sister Mary talked about. And we have the highest college tuition and the least financial aid of any OECD nation. Why does that matter? The biggest correlate of how long you're going to live is how educated you are. It truly is. So again, if we want people to be healthier, then we should be asking ourselves in every single one of our communities, what are we doing to make sure people are educated, that young people have an opportunity to go to college, to finish high school, to go on and get an advanced degree, because it continues with advanced degrees. The higher educated you are, the longer you will live and the healthier you will ultimately be.
Yeah, thank you. And we can't solve all of that, obviously, in this room, but we own a big part of solving that. And given the headwinds that you described and other headwinds coming our way, work requirements for Medicaid, ACA, enrollment reductions, what advice do you have for us as we embark?
There's a lot, and I'm going to go through a quick litany of some of the challenges you all are facing. There is what we call the silver tsunami. By 2030, baby boomers will outnumber children for the first time in U.S. history. We talk about Medicaid a lot. Medicare and Social Security are, by definition, Ponzi schemes. And I don't mean that in a pejorative way. I mean that in a very literal way. They're set up so that you have more people paying in at the bottom of the pyramid, putting in, than you have people pulling out at the top. The reality is that Ponzi scheme is about to implode because by 2030, we will have more older adults taking out of the system than what we have younger people putting into the system. Demand for healthcare services is rising while the workforce declines. 20% of practicing physicians are approaching retirement. Changing U.S. demographics. We're becoming older, more diverse, more multilingual, and that's going to change a lot of the demands that we have. And I just want to give a shout out again to Sister Mary. Fear of accessing hospitals among some communities is going to continue to plague us. And we're seeing this in many of the communities I work in. Women not coming in for maternity care because they're scared that ICE is going to be there. Political debates about who deserves care. This is an interesting one. Most of Europe adopted universal health care after World War II as an attempt to rebuild society. It wasn't thought of as an individual benefit, it was thought of as a societal good. That is not how healthcare evolved in the United States, or at least healthcare financing. It was, hey, you worked, so we're gonna give you healthcare as a benefit. And then it was, hey, you worked until you were 65, and so along with your Social Security check, your pension, we're going to give you a Medicare. And so we have a philosophical problem here in the United States in that we believe people deserve health care, which means that other people don't deserve health care. And that's a lot of the debate that we're having right now about whether or not prisoners, whether or not immigrants, whether or not people who don't work should have access to health care. Financial pressures on health systems, you talked a lot about HR 1, but also labor and delivery units are closing at an alarming rate. Rural hospitals, over 140 rural hospitals have closed since 2010. Emerging infections, we already talked about that. Guns, climate change, behavioral health. There's a lot on your plate. But to answer your question, I think the biggest threat to America's health is declining trust. I really do. Trust in public health institutions has fallen since the pandemic, with only 40 to 50% of Americans reporting high confidence in the CDC and the FDA. And that is leading to lower vaccine uptake, delayed preventative care, greater belief in misinformation. I got my colonoscopy last Friday. I posted about it on Twitter. Any of you all who follow me, go and look at the comments to me posting about getting my colonoscopy. About every third comment is someone saying, oh, that's just a scam by the healthcare system to get more money out of you. For my colonoscopy. Like, that is the world that we're living in right now. Increased polarization around evidence-based medicine. And trust now shapes outcomes as much as access does. So we talk about access, but we're not talking about trust and the fact that if you live in certain states or in certain parts of certain states, we can look at trust, and that is a direct correlate to whether or not you're going to get preventative care, whether or not you're going to get vaccines, and how long you are going to live. So what can you do? Well, make trust a system-wide leadership priority. Train frontline staff in empathetic communication, partner with trusted community leaders, improve transparency and consistency in your communication. Communicate early and frequently during crises. And the crises are going to keep coming, whether it's Ebola or Hanta. Improve language access. That's huge. When I was in medical school and residency, we were happy that we had a Spanish line. You know, now you need 10, 20 different language services in any given day to make it through a shift at a busy hospital. And address billing transparency and affordability concerns. You may not be able to change the price, but you can help people understand what they're paying so they don't become frustrated and end up like me with a $10,000 bill for dehydration. Recognize that in today's environment, your health systems are not just delivering care, they're stewards of trust, of information, and of community resilience. And so that would be my advice to what the folks in this room can do, is think about trust, measure trust, make sure we're following it like a quality metric.
Yeah. Thank you. And you've advocated for an ecosystem approach to healthcare. And how do you see stronger partnerships between providers, payers, government, business, community organizations, not-for-profits, NGOs lead to better outcomes for us all?
I literally wrote a report when I was Surgeon General, the first of its kind, because we didn't write it with medical folks. We actually worked with the Federal Reserve banks to write this report called Community Health and Economic Prosperity, where we talked about the need for partnerships and to take a stakeholder versus a shareholder value approach. That means partnering with suppliers in your local community. It means understanding the workforce issues in your community and going into middle schools and elementary schools and making sure people who are going to be the workforce of the next 5-6 years are healthy and happy and educated. It means working with the business community. How often do you have the business community in asking them what their concerns are? I will tell you, when I go to the State House to advocate a lot, I would rather have Elon Musk or Mark Cuban or the top business leader, and I'm in Indianapolis, Eli Lilly, not there as a healthcare representative, but as an employer. They're gonna have more influence over your legislators and the decisions they make than anyone waving the health care flag. So partnerships are so incredibly important. And what I would say is also important to understand, as I mentioned earlier, partnership has to include partnering across the political aisle. So many of us have put up walls. We've put up walls where we've said, you're on that side of the political aisle. I am not going to talk to you. I'm not going to listen to anything that you say. One of the blessings God has given me in my life is that I've had the opportunity to live all over the world. I've had the opportunity to live all over the United States. I found more diversity in the United States than I found living in Africa and living in Europe. But that said, I've lived in Laredo, Texas. I've lived in the most Republican district in Indiana, where I currently live. I've lived in Berkeley, California, where people proudly call themselves socialist. And I've found that most people just want to be able to prosper. They want to flourish. They want their kids to be healthy and happy. They want to have a good job. They want to be able to, at some point, retire. They want to be able to have health insurance, whether they're Democrat or Republican. And so I really think that it is important that we walk the talk in terms of reaching out to other people. And I tried to do that. And through these pictures, you see, that's me with Elizabeth Warren. And over on the other side, that's me and Bill Clinton. I love that story. And I'll tell you that really quickly. Bill Clinton and I were both at an event like this event. And we're both backstage. And my people told me, do not talk to Bill Clinton. Do not get in a picture with Bill Clinton. Because he was the enemy. He was the enemy. And Bill Clinton, his people told him the exact same thing. Do not talk to Trump's Surgeon General. Do not be in a picture with Trump's Surgeon General. Well, within 30 seconds, Bill and I are like this. But in that picture, I'm showing Bill a picture of my daughter on our phone at the White House underneath his official portrait. She's sitting on a sofa underneath his official portrait. And he's telling me about Chelsea growing up in the White House. And the lesson there is that everyone was telling us, you're too different. Don't talk to one another. But the reality is, we quickly found something that we shared in common, and that was our love for our kids. And if we look for what we have in common as opposed to focusing on what causes us to be different, which is what Fox News and, again, MSNBC want us to focus on, if we focus on what we have in common, we will actually be in a lot better place.
Thank you. What a wonderful. And thank you for not just saying it, but leading by example and showing that. And thank you for your time with us here today, and thank you for your service to the United States of America.
Thank you. And I know we have to go, but I really would, can you throw up my last slide? I want to talk about, I really do have, I don't want you to leave here feeling frustrated. There are a lot of things that give me hope. We're truly at a watershed moment in regards to healthcare delivery with AI. I mean, it is drastically going to change the way healthcare it already is changing the way healthcare is delivered in our country. Open Evidence, any of you all use that? Open Evidence is like the chat bot for medical professionals. It's like ChatGPT for medical professionals. It scored 20% on the medical boards 5 years ago. Last year, it scored 100% on the medical boards. So AI is already smarter than any doctor or nurse out there when it comes to information recall. Well, you say, well, they're not as empathetic as doctors. Actually, they're more empathetic than doctors. There are multiple studies that came out last year that showed when you compare a chatbot to an actual physician or nurse practitioner, the patient prefers the chatbot and feels like they are more empathetic. Why? Because they can customize to your educational level, to your language level, to your culture. And so when we look at ambient AI, that is the ambient scribes. That's the biggest use case that we're seeing adopted right now in hospitals. And I encourage you all to think about that if you don't have it in your hospital. But we have drugs with the potential to significantly alter health trajectory. GLPs, again, amazing. I'm worried that people don't have access to them, but we're finally seeing obesity rates go down in this country after decades of rising because of GLPs, which means cancer rates are going to go down, which means diabetes rates are going to go down. We see targeted therapy for pancreatic cancer. You saw the news just last week, mRNA for melanoma, gene editing for sickle cell. We can cure sickle cell disease right now. Problem is it costs $1 million a treatment. We have a president and other influential individuals, Mark Cuban with Cost Plus, who at least are willing to talk about drug pricing. And we have people who are really leaning into value-based care. This is Vivek Ramaswamy just last week talking about value-based care as he's running for governor of Ohio. Whether you like him or not, it's good to hear someone talking about the need to shift from fee-for-service to value-based care. So ultimately, my challenge that I want to leave you with is to be the change that you wish to see in this world, because we are stewards of a system under strain, but we're also the architects of what comes next. And so the challenges are real, and you see, I don't shy away from any of the challenges you all face. You got to be very honest about those challenges, but the opportunities are even greater. And so go out, grab those opportunities. Despite all that's going on, am incredibly hopeful, and I don't think we're going to recognize healthcare 5 years from now. When you all come back to this meeting in the next 5 years, drastic changes because of all the things that I mentioned earlier. And if you want to hear any more about my story, you can check out my book. I don't make any money from the book. I actually use anything that I make to donate books to other people because, again, I never saw someone who looked like me growing up. So if I can give my book to someone, to a young person who might not otherwise be thinking about going into medicine or becoming a Surgeon General, then that's what I do with it. So thank you all for the opportunity. Thank you for all that you do, and have a great meeting.
Thank you, Dr. Adams.